Welcome to our weekly 3-minute therapy podcast. And I'm Dr. Michael Edelstein, clinical psychologist, author of 3-minute therapy, and co-author with Mick Berry, who's going to be joining us on stage fright. And it's using REBT to address performance anxiety. And REBT is rational emotive behavior therapy. It was devised by Albert Ellis in the 1950s, and it dramatically changed the course of psychotherapy from the more traditional therapy of talking about your childhood and early problems to the now very popular cognitive behavior type therapies. Albert Ellis wrote over 80 books. You could always find an interesting book of his applied to different emotional problems. And I'll be joined by Mick Berry. And our guest today is Aldo Pucci. Aldo is an REBT therapist whose brand is called RLT, Rational Living Therapy. And Aldo does a supervision group. If you're a therapist and you'd like to join the supervision group, it's generally Mondays at, is it 1 p.m. Eastern time, Aldo?
2 p.m. Eastern.
2 p.m. Eastern time. And I've been going to those. They're really helpful, really great. Okay, today we're going to be discussing the idea of traumatic experiences, if they exist. It's a very common topic among therapists. Therapists like to go back to your childhood and so-called traumatic experiences. And Aldo, did you want to say anything else about yourself?
I'm president of the National Association of Cognitive Behavioral Therapists, and we conduct trainings and seminars and workshops, and like Michael said, provide supervision as well. And the issue of trauma, so-called trauma, comes up often in trainings, even trainings that have nothing to do with the topic of trauma. Somehow that topic seems to come up, especially nowadays. Yeah, for sure.
That's interesting. And you've written a couple of books, Aldo, is that correct?
Oh, yes. The Client's Guide to Cognitive Behavioral Therapy, which is a sort of companion manual for the client in therapy, follows the course of therapy and provides self-help assignments between sessions. The self-help version of that book called Feel the Way You Want to Feel No Matter What.
Okay, sounds great. Sounds great. So I'll take a first shot at the concept of traumatic experiences, and then both of you please join in at any point. Sure. And I think the phrase traumatic experiences misunderstands how emotions work. Presumably the term traumatic experience means an experience you have that you upset yourself about it, and the fancy word that sometimes uses, traumatize yourself about it. So it's not the experience that leads to your upsetness or trauma, but it's what you tell yourself about the experience. And different people can have the same experience and feel very differently about it. So traumatic experience is really a misnomer. Aldo, did you have anything you wanted to give us your perspective on that?
Sure. Well, first of all, yeah, the term traumatic experience, I agree with you, Michael, implies that the experience itself, the situation, the event is what caused the reaction that is labeled trauma. So the reason I have this trauma, so to speak, as people often describe it, is because I had this traumatic experience that caused this trauma. Now, sometimes what people will do is call the event itself the trauma. I've noticed that a lot. I experienced trauma, in the event itself. Whereas, and the interesting thing about this is even I hear this even more from therapists than I do clients. You know, the DSM years ago, the Diagnostic and Statistical Manual, which is really the billing manual for mental health professionals.
Yeah,
Right. That's why it exists.
that's the only use it has.
That's it. That's right. Yeah, there are two reasons why it exists. One is because psychiatrists are medical doctors, and they wanted diagnoses just like all other medical doctors. And two, so that they could bill for what they do. Mental health professionals could. But for the diagnosis of PTSD, one of the criterion was that what you experienced had to be out of the ordinary or unusual. But today, if someone, I hear people say, well, he called me this name and I was traumatized. So even the uniqueness of it, or the unexpected nature of it seems to, that requirement seems to have disappeared. And so what they're really focused on is how the person is feeling. And what trauma really is, I believe, is just like you said, a misnomer for high anxiety. A person is making themselves very anxious about something that they experienced, and or they made themselves very anxious at that time, and then the reason they continue to feel very anxious is because they haven't learned how not to make themselves anxious when they think about it, and also they're afraid that something like that will occur again. And so as long as they fear that, and they think the likelihood is significant, then they will make themselves anxious over it, reminders of it. So then you have the flashbacks, so to speak, which are just memories. But there's a lot of anxiety. There's a highly anxious reaction to that imagery because of the thinking, the very fearful thinking about it. But yet somehow this is as if it were a different experience than what anyone else experiences who thinks about something, is reminded about something that they upset themselves about, but somehow these are flashbacks, and so like you said, Michael, I really believe one of the main problems with this whole idea of traumatic experience is it's a misunderstanding of how our emotions actually work, and that we believe there is no such thing as an objectively traumatic experience. If there were such thing as an objectively trauma-inducing experience, then everyone would react the same way if they were exposed to that type of situation. But now, are we surprised if people within a given society react very anxiously to certain events? No, because of learning, and some things are more common in some societies than others. Some things are more to be expected in some societies than others. And so there's no doubt there are some things that will get our attention more, might lead to confusion more, because it's hard to believe that what's occurring is actually occurring. But the event itself isn't causing the anxiety. It's our fearful thinking about it. And I'm very thankful for that fact.
Yeah, right, exactly. Mick, did you want to get a word in edgewise there?
Well, I think that traumatic experiences, or trauma, it's become the in vogue term of probably the past 5 years, and it's being used more and more. And also PTSD. George Carlin did a very funny bit about this. The term for soldiers coming out of battle and being wigged out has always changed. After World War I, it was shell shocked, and then After Vietnam, it was combat fatigue, and now it's PTSD, and so I forget the point he was making at the time, but it's always changed. We have to come up with a new term to make it valid for today's generation. And Aldo said, it's Aldo, right? Sorry.
Right, that's right. Yeah, Aldo.
Aldo said, there was something there where he said, we believe that trauma doesn't cause us to be upset. I'd like to amend that, Aldo, and say it isn't something we believe, it's something we observe. REBT, or cognitive therapists, observe that trauma doesn't cause us to be, or the event doesn't cause us to feel trauma. It's the way we think about the event. So it isn't a matter of us believing it, it's what we observe, and all evidence indicates. As you said, if an event caused us to feel traumatic, then people would have no choice. But two people experience exactly the same event and they have two different reactions, especially if you take it to 100 people, there are going to be all these different reactions. I think there's certain circumstances that are by all means best avoided and avoided to experience again, such as rape, or I would never want to have to experience combat. But people that experience these things do not always have the same experience, and not all of them have it as a lingering emotional problem in their life.
Yeah, very good. Even something as extreme as combat, there's some people who enlist in the military because they want to prove what a macho man they are, and get a Purple Heart, or they have an idea that the enemy is out to get them, so they're protecting themselves, things like that.
And let me just throw out, in those circumstances, it's not like they're two extremes, ruin your life emotionally or become a hero. There are also people that experience it that don't want to experience it, and then come out of it and say, well, I'm glad that's over, and they go on to something else.
Yeah. Okay, does anyone have any last words about that? Otherwise, I wanted to ask Aldo a different question.
Yeah, sure. I wanted to mention something in response to what Mick was saying. That I agree with you completely. As a matter of fact, we teach that it's a fact that our thoughts cause our feelings and behaviors, not just an assumption. And what drew me to Maxie Maltzby's work originally, whose approach was rational behavior therapy, and who's a student of Ellis's as well, was that he being a physician, just mapped out the psychoneurophysiological reason why our thoughts cause our feelings and behaviors, not people and things and situations. So no, I agree with you. We don't present it as a hypothesis or a guess. We present it as a fact that our thoughts cause our feelings and behaviors. Yeah.
Very good, very good. Aldo, did you want to say a few words about any differences between REBT and what you do, rational living therapy?
In relation to
in relation to your therapeutic approach or therapeutic assumptions?
You mean just generally speaking?
Yeah, generally speaking. Yeah.
No, well, I think one difference is, and this is based on the influence of Maxie on me. I think one difference seems to be that the ABCs of REBT are more, they seem to be more of a therapeutic technique to help people to move from unwanted emotions to more desirable emotions. Whereas the ABCs that I learned from Maxie that we use are the ABCs applied to any situation or any emotion or behavior as an explanation for how a person came to feel the way. In other words, there's not the D and the E, to follow.
So with Maxie's approach, rational living therapy, or he called it rational behavior therapy.
Behavior therapy,
Yeah.
right.
So A, B, and C is used diagnostically and to understand the theory, but there's no D, E, and F where
right that comes later, right. That comes later, but not within the ABC model itself.
I see. Yeah. I can see that.
Yeah.
Okay, yeah,
yeah, sure. And that's the difference that comes to my mind at the time. Yeah.
okay, very good. Well, thanks for joining us, Aldo, President of National Association for Cognitive and Behavior Therapy. Thanks, Mick, my co-author, and thanks, Chris, our tech engineer, for making it all happen. And if you have any thoughts about the discussion, please comment below. Give us a like if you felt positively about it. Suggest subjects you'd like us to discuss in the future. Volunteer to be a guest. We're always looking for guests. And donate to Patreon if you'd like to help support us. And subscribe to the 3 Minute Therapy podcast to stay on the rational side of life.